My name is Katie Golden, and I'm 39 years old, and I live in Santa Monica, California. I'm here today to ask you to consider three different issues that are very important to my health and to the health of millions of Americans. First, I want to address access to care. The barriers that are put in place for patients is ridiculous. I don't need an insurance company to tell me that the medication my doctor has prescribed is not what I need. I don't need to jump through hoops. I don't need to I don't need prior authorization every single time I need a procedure or a nerve block that I have been taking and doing for years. I don't need to jump through the red tape. It's hard enough to manage my day to day and to deal with my brain fog that I don't shouldn't have to deal with prior authorization, step therapy, or non-medical switching. It's ridiculous, and it further impacts my health when I can't actually go the path that my doctor and I have decided. I suffer. My health suffers. I also would like you to consider telemedicine. During COVID, healthcare providers have pivoted very quickly to telemedicine. I can't tell you how many times I missed an appointment because I couldn't get out of bed. I couldn't drive myself. I couldn't even think about getting in a cab because I was going to puke all over in the car. Um, Now, during my worst times, I can still see my doctor. And that's been huge. And it's helped me to stay out of the ER. So, telemedicine is huge, and I can ask you to consider reimbursement rates um, for Medicare and Medicaid and for telehealth. And the last thing I would ask you to consider is uh, mental health. Depression and anxiety are the highest comorbid diseases with migraine, and yet many of the treatments for depression and anxiety are not covered. Alternative treatments are not covered, or they are not deemed necessary. You can't deal with just the one disease without addressing all of the issues that stem from it. So I ask that, again, mental health services be expanded, be encouraged, and not stigmatized. So thank you for listening. I appreciate your time. And again, as I said, anytime something comes across your desk that could help me and millions of others exactly like me, please consider that and do what's best for the patient. Patient first, not insurance first. Thanks.